Before placing ECG leads on the patient, you want to make sure you pick the correct electrode with the correct ECG cable. There are 3 types of ECG cables that pair with the 3 different electrodes. The CV ECG cable is made for the CV quattrodes, which are the quattrodes that are separate. The standard cable is made for the single patch quattrode, and the neonatal cable is made for the neonatal quattrode. Tips: CV quattrodes work best for females and overweight patients. Not using the correct ECG cable with the correct quattrode will affect your ECG output. You may get increased artifact. After you have chosen which cable and quattrodes to use, the next step is to prep the patient. It is important to shave any patients with excessive hair. If the hair creates an arc behind the quattrode, it can be a burn hazard. After the patient is shaved, use the skin prep gel on the areas where the quattrodes will be placed and briskly rub the selected sites with the gauze pad. The skin may turn pink. This gel is an exfoliator and gets rid of dead skin cells. Wipe excess after scrubbing. Tips: the skin prep gel will clean and enhance the skin, which will improve the ECG performance. You will be less likely to get artifact. Alcohol swabs break down the conductive properties of the skin and degrade the ECG performance. When placing your quattrodes, you will go to the imaginary nipple line on the left side of the chest and place 2 in line with that side. Then place the other 2 on the lower half. All of them will be slightly to the left side. Do not center them on the chest. If the patient has a large breast, the quattrode goes under the breast tissue, not over it. After placing the quattrodes, make sure the ECG cables do not cross. When using the standard quattrodes, the top half of the quattrode will be in line with the imaginary nipple line. The patch will be slightly to the left side and not in the center of the chest. When using the neonatal quattrode, the patch will be placed in the center of the chest. Once you have placed the quattrodes, you will want to refer to the ECG reference line on the MR400 to see if you have good signal strength. Should be at least 1 millivolt. That is, the waveform should be equal to or greater than the size of the scale indicator. In some cases, a 1 millivolt ECG signal cannot be achieved due to patient physiology. In these cases, try to achieve the largest amplitude attainable. If it is not, then you will most likely get artifact. If you prepped your patient correctly and placed the quattrodes but are still not getting the QRS high enough in relation to the reference line, there are a couple of things you can try. In some cases, a 1 millivolt ECG signal cannot be achieved due to patient physiology. Tips: if you start your scan and you begin to get artifact, go ahead and try to change the filter. These filters were made to weed out different noises from the MR. Place the module on a cushioned surface such as a blanket or towel to minimize MR vibrations. When storing the module after the case, make sure to store it downwards where the leads are hanging. Storing it upwards will stress the cable and eventually break them.